Thank you very much. Very pleased to be here today and very happy to introduce you to 1215 Molecular Diagnostics. You know, perhaps I should start off and explain what the heck the title of the company means. The company deals in very, very small things on what we call nanoscale, things that nano means 10 to the minus ninth. Well, 12 means 10 to the minus 12th, which means femto, and 10 to the minus 15th means pico. What we're saying is that we deal with very, very small things, and is obviously applied to molecular diagnostics. Let me tell you about the company. This is a company that's 5 years old. We're based near Yale in East Haven, Connecticut. Right now, we have a platform technology. In other words, it's good for a lot of things. We're using it for COVID-19 diagnostic. We can detect whether somebody's infected, whether they have symptoms or not. Frankly, we can apply this technology to virtually any pathogen, any virus, any bacteria, any fungi. And it could be contained in saliva, which we're working in now, or blood, or potentially other bodily fluids. Our technology has nothing to do with PCR, which I'm sure you've heard about. What we do is we measure the fact that a piece of DNA and a piece of RNA, let's say in a virus, bind together. That's called hybridization. When that happens, we can pick that up in our test unit. Our limit of detection, or our sensitivity, is roughly comparable to the big expensive PCR machine that is in the laboratory. As I mentioned, we're focused on COVID-19 for the very first application of our patented technology. We have demonstrated in our lab that our process is very accurate, which is great, but even more important, we have demonstrated 98% accuracy in clinical trials. And our accuracy was further corroborated at Yale by the people there who have one of the few places where you can take a saliva sample and put it into a PCR machine. So they also agreed with us. We plan on getting on the market by the end of the year by receiving an emergency use authorization from the FDA. We will be sold as what's called a point of care test, and I'll be telling you about where we might be selling that a little bit later. We have been working with the NIH for the last 4 months or so. They have awarded us $200,000. They have recommended us for another roughly $160,000. And we're hopefully working with them for them to introduce us to another, well, let's say more than $10 million. We'll see how that comes out. The fact that we've gotten any money from them puts us in the top 5% of companies in this field. Over 700 companies have applied to the NIH for funding, and only 30 of us have gotten funding. Right now, we're raising $5 million, most likely in 2 equal tranches, which I will describe a little bit later. The problem, we would love to know if we want to detect COVID-19 as soon as possible. You clearly want to know when someone is asymptomatic, if they don't have symptoms, but they're carrying the virus. You want to know that because a patient can carry up to 12 days the virus without any symptoms. So clearly you need to know whether that asymptomatic patient is carrying the virus or not. You'd love to have a cost-effective, say cheap, solution at point of care, rather than, for example, with the PCR machine, which has to be sent to the lab and days go by. You would love a user-friendly test that's easy to do, and you must be able to detect variants of COVID-19. With all of the variants around, obviously, you must have that flexibility. You'd love to do this at home, and we understand that. So where are we now? We now have a test that we think we can price at roughly under $20. Our test uses saliva. No one is going to cram something up your nose. We get results in 7 minutes, and our results are accurate, 98%, even with people that don't have symptoms. Our technology uses graphene carbon-nanotubes, which we have shown works very reliably, unlike many of our potential competitors. In the near future, we hope to combine our COVID test with a flu A and flu B test. So when you walk into the test place, they'll be able to tell you, you don't have COVID, you have flu A, which obviously will put your mind at rest. We can also test for specific COVID variants. We are designing now our test to be suitable for home testing for COVID. And however, our technology is more general. We can detect virtually any pathogen, and we also think we can be useful in diagnosing cancer and monitoring the progression of cancer. Our business model, we are choosing to start selling our product in retail pharmacy chains, for example. In the back room, perhaps, where they're giving flu shots, or perhaps in a drive-through format, where many chains are now offering a COVID service. Right now, this is a very large segment of the more than 25%, for example, of our flu vaccinations are done in this kind of a setting. We plan to have a test that will do both flu and COVID, as I mentioned. And the total available market, that's what TAM means, is $5.5 billion right now at the current testing rates. So obviously, we don't need to have a big part of that in order to be a very successful diagnostic companies. Here are 6 companies that are our target partners. We have already had conversations with one of these chains, and frankly, are about to go back and have further conversations with them. This is a Gantt chart of what we're doing. The key takeaway here is that we will be on the market after we have our approval from the FDA by year end. This is our financial forecast. Year one is not this year. Year one starts when we're funded, hopefully later this quarter. You can see our sales forecast there for the first 4 years. And you might wonder, well, that's nice, but I wonder what the company will be worth if you achieve these various sales targets. Well, right now, if you look at a number of molecular diagnostics companies, both public and some acquisitions that have been done, you find out that they are valued very highly. Right now, these kinds of companies are selling between 10 and 20 times sales, not EBITDA, but sales. So, for example, were we to achieve our year 3 forecast of $35 million, the company is worth, according to this, assuming obviously we make the sales forecast, somewhere between $300 million and $600 million. That's a big number. And when you see how much we're offering to sell stock in the company right now, you'll see it's a very big number. We think we need $5 million, and the cash flow analysis that you see at the bottom of the slide shows that $5 million should bring us through to cash flow break even. Once again, assuming we meet the sales forecast that we have here. We are offering right now to you and other investors $5 million. We think that a 2-tranche approach works the best for everybody. The first tranche is $2.5 million. About half of that is to scale up our production, complete the development of our Gen 2 device. That's the device that will detect both flu A, flu B, and the virus, and to submit our 510K. One of the other, you need 2 kinds of approvals right now from the FDA. The first is what's called an EUA, an emergency use authorization, but that's a temporary authorization. You need a full approval, which is called a 510K, and that's what that is. The other 1.4 million out of that 2.5 is to gain our initial approval, the EUA. Once we have that, we can sell, just like everybody else that you see on the market. Pfizer, Moderna, they don't have a full approval, as many people know. They have an EUA, which allows them to sell their product anywhere in the United States. The second $2.5 million will be to fund our sales growth and develop our new products. For example, our product in cancer, and also to gain the 510K approval. Right now, we think that we have enough employee growth to attract 5 investors at $500,000 apiece to raise $2.5 million for EB-5 funding. We are offering for each $500,000 investment to get a 3.4% ownership in the company. That amounts to valuing the company at roughly, let's see, it's 14 pre plus 2.5 plus 5, at roughly $20 million valuation. So obviously, if we achieve the kind of valuations that I mentioned earlier, this will be a fabulous investment. Our management team is currently led by our CEO, Dr. Sayan Sinha, who is our founder. He's a professor of bioengineering at the University of New Haven, and he's been working in the field of nanotech for over 20 years. I'm currently serving as chairman. I have had over 25 years as a medically focused venture capitalist and a former executive with Baxter Laboratories. Our chief operating officer is Rob Broderick. He has 13 years experience in medical device operations and general management. And John Francis is our Chief Marketing Officer with 20 years experience with global sales and also diagnostic experience in his career. We also have our Chief Technical Officer, Dr. Kakor, 30 years as a materials expert in the nano field. Milton Chang is our VP Engineering, 20 years in R&D and project management in building complex electronic kinds of things. And our microbiologist, our molecular biologist, Dr. Ali Sinajani, our Chief Scientific Officer with over 20 years experience in genetics and molecular biology. Job creation summary. Right now we have 7 full-time employees. We have, as you saw from the previous 2 slides, 7 other people who are working here, but they're not full-time employees because we're not taking any salary right now. As soon as we're funded, we will. And by the end of year 1, which is 1 year from funding, and we hope funding is later this quarter, we will have 36 people on board, composed of engineers, scientists, marketing people, et cetera. The end of year 2, 51, the end of year 3, 66 people. And by the end of year 4, we're looking at a total organization of 77 people. Now I'll say thank you very much.